Okay, we're back. 847-931. There you go. There's Joe Walsh.
More Joe Walsh.
847-931-1410. What are we talking about? Healthcare. See this? Did you think it? Whenever I see a picture of that Secretary of Human Services, I think of Hillary Clinton. They must be cousins or something.
Oh, I think the Bride of Frankenstein.
Yeah, she is something
Very
else, isn't she?
square-headed.
She's something else. What do you think, Paul? You know, we talked about this healthcare bill back on the other radio station we were on, and I said it would never pass. And you said, oh, I think you got dinner out of that from me.
Yes.
And now the Republicans said they're going to dismantle it, and here's this Bride of Frankenstein-looking lady gets up there and says,
I don't think you should be insulting the Bride of Frankenstein like that.
I'm sorry.
She's never going to come on our show knowing that we talked about her like that.
So here she is, full steam ahead. She didn't get the memo.
Well, this she didn't get the memo. And that's the Munsters, isn't it? Tony's big on TV show themes. Is this not the federal government regulating whether or not a corporation can make a profit?
Yeah.
But
what I'm surprised.
But put that to the side, Tim. Does this? What do you? I mean, this is your business. This is your industry. What are your thoughts about this?
Well, it's a hard thing to say what actually goes. First of all, the hard thing to do is if you're self-insured or you're partially self-funded. We do a lot of self-funded groups, large groups. There's usually a 90-day to a 6-month lag before the claims get through the system. So if I went into the hospital today, I went over to Good Shepherd Hospital, and I was hospitalized, it would probably take 90 days before the claims, and then there would be questions about the claims. They give me, $20 aspirins. There's so many different things. I don't see any way in the world that they can actually say what the medical loss ratio is. I don't see how they could do it. And plus, insurance companies have taken over the industry because they are practically almost medical practitioners. They have medical directors, doctors. They have doctors on. They spend money in research and development. They do contracting. I mean, just the fact that they go to the doctors and they get the doctor to accept to take a 30% discount. They have a whole unit of people that do that kind of thing. So I don't know how you could say to them, we're going to limit 15 to 20% for administration costs because there's a lot of other things they do. And I'm not pro-insurance. I'm not real pro-insurance. I was mentioned in Crane, Chicago about 2 weeks ago. They did an article with me, and they had asked me why Blue Cross and Blue Shield was raising their rates 28, 30%. And I made the comment, I said, well, they're doing it now because nobody knows what they're going to be doing in 2014. And Crane's published the article and said, Tim Elenz, benefits age, says they're doing it because they can. I get these calls from Blue Cross and Blue Shield. It's not really true. What's happening now is the government is changing the rules in the middle of the game. And we had a nice talk about that. What do you guys think about it? Did I answer your question?
Yeah, I think the thing is that you and I look at things from the same issue from a different perspective. I'm always looking at it just from the idea that, okay, here's the government telling a private corporation how much money they're allowed to make. And I think a lot of people go, yeah, those bad insurance companies. But then when people realize that in just about every one of your mutual funds, your 401ks, all that, you probably own some stock in those insurance companies. So what happens then is you start losing money on your portfolios, and then you're like, oh, my portfolio isn't performing. And well, yeah, they just took the profit out of from you as well. These are publicly traded corporations.
Well,
they're supposed to make money.
Tony wants to weigh in on this, and I'm
Please.
not saying this to kiss butt the Blue Cross and Blue Shield because I don't really have any
allegiance. Trying to make things up.
No, I just
after that bad Cranes
article. And I don't like insurance companies, but I'll tell you what, as far as medical insurance companies, Blue Cross by far is the best run, managed company. I mean, professional people pay the claims, contract, pay the doctors. And again, I'm not saying this to Blue Cross, but I honestly believe this, and I don't even think there's a close second as far as the way that they treat all the players.
Okay.
Involved.
Do you being here in Illinois, do you do anything with Kaiser?
A little bit on the West Coast.
The reason I ask is I have an aunt who lives out in Sacramento.
Yeah.
And she works for Kaiser. Mm-hmm. And she's a nurse, and she actually works in this big phone room. So if you're a Kaiser patient, before you run off to the emergency room or what have you, you're required to call in, and they take an interview over the phone. And a lot of times they will never tell you not to go in if that's what you want to do. Right. But a lot of times they're able to take those symptoms and say, hey, this is what you got going on to a certain degree. Now, not telling you not to go if that's what you really want to do, but you know what? It sounds like you got the hiccups or what have you. So they're able to help them through a lot of things.
They require that?
I shouldn't say that because I don't know for a fact that they require it. It's available to the patient. So but if you're part of an HMO and they require, just like before if I go to the emergency room, I typically, if I'm home, I have to call my doctor first and say, hey,
get the referral,
and he may say, no, that's really not a big thing. You should wait. Now, my doctor's never told me not to go.
I'm just stunned that you have an HMO still.
Pardon me?
I'm just stunned that you have an HMO since those plans are becoming obsolete.
See, and I
on the West Coast.
And I'll tell you what, I like HMOs, me personally, and the reason I've always liked it is simply that I know what my costs are, and I'm very active in managing my care. I interact with my doctor. If my doctor says, no, I don't think you really need that test, I say, no, I really do need that test.
Right. You're right.
And I'm involved in managing my care. I'm very in tune with my body. And, there was a point where I had a little ache in my calf, and I knew I hadn't done anything to pull a muscle. And I'm like, Doc, I got a blood clot. He's like, well, you have no symptoms, but I'm like, Doc, I got a blood clot. He sends me for an ultrasound. What's in my leg? A blood clot. Now, none of the symptoms dictated that I have it, but my doctor is in tune with providing health care, and I appreciate my doctor. By the way, that's Dr. Anthony Lynn of Villa Medical Arts in Addison.
Send him a bill for 50 cents.
No, he's a great doctor.
What are you going to say, Tony? Tony was like, go ahead,
Tony. I actually am curious because you and I have had this discussion before in terms of what you think healthcare is. I personally think it's very difficult, and I have a wife who has a medical condition, and our bills have been pretty extreme this year. And the reality is, though, I pay them. I pay them because I want my wife to be taken care of. I want the best care possible. And I think to your point on where society is going, we're getting to this notion where you don't have to pay for things. And that's just a simple non-reality. So I'm more curious on your end where you think the marketplace goes to actually meet somewhere in the middle. Me personally, I would like to see actually the elimination of corporate insurance because to me you then open the marketplace up, because if it's to the individuals, then it's the demographics of the health of the individuals, not by the company's individuals. So instead of having a big company like IBM, for example, that has 50,000 people, they're looked at as much better than Bob's Fish Market down the street. However, if everyone was striped across an individual layer, then it would be the demography of, Paul here is slightly overweight. Me, I have hypertension. So they would start splitting people up into the classes of healthcare.
Are you calling me fat?
No, slightly overweight. There's a big difference.
I'm fat.
Thank you.
Tim is fat.
Yeah.
Well, but Tim, one of the things is in your business, you've always said to me, Paul, the reason you provide benefits is because that's how you really attract and keep your employees. The better the benefits that you provide. And for a small company, I try to provide some pretty decent benefits for my people, and I think to a certain degree there are people who maybe, even though maybe the salaries I pay aren't as high as somebody else, they know that, for instance, I think my family plan costs $1,100, and I pay, I think it's like $750 of it, and my employee only picks up that little bit extra. That's a benefit I provide, so I would not want that taken away from me because I know that helps me run my business. Now, the competitor down the street who's not going to provide that quality health care for his employees, maybe I have an edge over him, but that's a business decision. I wouldn't want that taken away from me.
But see, you're stating my point.
Yeah.
You're choosing that as a means to bring people in. How do you know if you leveled that playing field, you wouldn't be able to attract the same sort of talent, and you wouldn't have more people?
Because I'm a terrible guy and a terrible boss.
Oh, okay.
If I didn't have benefits, they'd all run out on me.
Well, that's different.
Well, see, this is where my Democratic side that Paul talks about, my left side, we're paying for the people that don't have health care. You're paying it in your premium. We pay higher premiums because of the people that don't have it. And, even the government programs.
Talking based on emergency care.
Emergency care, conditions that get worse, that the unpaid, the undocumented people, they use fake Social Security numbers, or the people that are documented use fake Social Security numbers. We have a public health care system here. Everybody has access to health care. I agree. They don't have access to great health care. They don't have access to health care choices, but everybody has access to health care. And I've said this before. If it were up to me, I would just totally nationalize Cook County Hospital. I would take it away from Cook County. I would run it like the VA. It would be better than Cook County. It wouldn't be the perfect solution. The Veterans Administration has one of the best medical outcomes in the world. Not in the country, in the world. The VA has.
What
I'm
do you
talking
mean
about
when
practice.
you say medical outcomes?
As far as the practice of medicine and the way that they treat people and the outcomes compared when they look at 1,000 patients or 10,000 patients.
So your overall health and well-being of the individual post and pre-care by this.
According to the World Health Organization, the VA is one of the best. But we have these little local governmental agencies.
That same organization said the U.S. was down at about 52. I read that study.
37.
Yeah,
37.
I read that study. Did you look at the variables
37.
that they were actually
Well,
weighting?
they were comparing dollars, the dollars that we spend per capita. They were saying, and so you can't, when you got 40 million
there's a
people.
litany of variables in that
Right,
study. It's a
but
very
that was the
interesting
biggest one.
study that you're
saying
talking
that if
about.
you spend $6,500 per person per year, what are you getting? And when you look at France, they're spending $3,700 or $3,500 per person per year. They're getting a better outcome.
Exactly.
That's what they were saying.
They're basically stating as their thesis that socialized medicine is a better form of medicine.
It is not.
Because they're talking
no.
per capita. They're not talking about quality of care and actual outcomes in care. For example, prostate cancer in the U.S. compared to the rest of the world. Breast cancer, U.S. compared to the rest of the world. If they looked at those studies and actually put the medical outcome, it would be a big difference. All my point is, if you look at that study and they're putting the VA up there, I question the study.
But I'm just saying that anything's better than having Cook County Hospital run by Cook County.
Well, yeah.
Or Cleveland Clinic, not Cleveland General Hospital, not Cleveland Clinic's one of the best. But one of the public systems should be taken over and systemized to be run properly. Cook County Hospital costs 4 times more than Rush St. Luke's or Northwestern Memorial Hospital, which is, 2 miles from Cook County Hospital.
And they're great institutions, those two.
The practice of medicine is very, very good there. But Cook County Hospital has 9.5 workers for every patient, where the rest of the country, geographically here in Northern Illinois, has 4.
And why do you think it would be run better if it were?
It would be run better because you wouldn't have this political cronyism, as Mr. Rauschenberger, when he was on here, said. It's a Democratic patronage heaven.
Well,
down at Cook
why
County
would
Hospital.
that change?
What do you mean?
Again, and I have a very basic understanding of government.
Sure.
And that is, why does nothing work well in government?
Oh, no, I know where you're going. You're saying, why would the VA be better?
That one corrupt form of government replacing another corrupt form of government would make it better. I don't see that. That's 1 minus 1.
No, what I'm saying is it would make it better than the current situation is with Cook County. The VA, I'm saying, is the VA is less of two evils.
So it'd be less broken.
It'd be less broken.
Okay.
Yeah, it would still be broken.
Yeah.
And I have these conversations with hospital executives, and they make that statement. The VA has some major problems. You got to start somewhere.
But is your assertion then that all of the people who abuse emergency care would then funnel into this nationalized healthcare building? Let's just call it that.
Yeah, you're listening to Left, Right, and You on WRMN 1410 AM.
Okay.